Now we will continue our chapter of intelligent and cognitive functionings. My name is Asd and I would like to present about deficiencies and disorders of intelligence. So before I start, I would like to share a quote from one of the most intelligent person well known, who is Albert Einstein. In the middle of difficulty lies opportunity. He is being diagnosed with intellectual disability, but also known as the most intelligent person in the world. So for this part, we will learn about the effects of aging in intelligence, the loss in performance, and also intellectual disability. Effects of aging on intelligence. As we age, there will be the decline in cognitive function, in which our brain will be reduce the activity of numerous genes that involve in long-term concentration and memory storage. It particularly affects genes that involve in synaptic functioning and its plasticity, and genes that are responsible for glutamate and GABA receptors for synaptic vesicle release and recycling. There is overestimates that older people will decline in their intelligence, but it depends on what kind of intelligence that we're talking about. Firstly, crystallized intelligence. Crystallized intelligence is skills and overload knowledge. It remains stable and it always improves. For example, vocabulary intelligence, it improved to 7 decades. In other hand, fluid intelligence is like problem solving, reasoning, and ability to process. It declines beyond 3 decades. Now we come to the terms of aging gracefully. To determine intelligence in general is the ability for the brain to integrate activity between brain areas. Default mode network is a portions of frontal, parietal, and temporal lobes that active when the brain is rest or focused internally than outside of the world. So it's a thought on to represent preparedness of action. So aging gracefully indicate that all people hold their own through of additional neural effort. During the study of memory tasks, right prefrontal cortex in young and older adults shows signs of activity who perform poorly in the memory task. But both prefrontal cortex show signs of activity for young and older adults that perform very well in memory tasks. And then we come to the topic of loss in performance. What are the causes that can cause performance to be lost? Firstly, non-physical cause. Non-physical cause is such as older people often lack of opportunity to use their skills, but even if they regain their opportunity to do the skills, they will perform it nicely and well. Secondly, physical cause. Physical cause is like diet. The study shows that cognitive decline 30% less in those who ate 2 meals of fish per week. It's because it contains B vitamins that reduce rate of brain atrophy. B vitamins actually slows the gray matter of atrophy by reducing homocysteine. Homocysteine is a toxic compound that elevated in people with high diet animal protein. Next physical cause is sex hormone. A study of menopausal women who undergo an estrogen replacement therapy shows reduced decline in verbal and visual memory. It also lowering the risk of Alzheimer's disease. There is no study that how estrogens correlates with intelligence, but researchers knows that there is neuron that have estrogen receptors in the brain. And now we will talk about intellectual disability. Intellectual disability is the limitation in intellectual functioning such as reasoning, learning, problem solving, and adaptive behavior that is developmental in origin. How to be diagnosed by to intellectual disability or ID? The DSM-5 criteria of ID is IQ at or below 70, deficits in adaptive functioning such as their communication, how they participate in social, and also how they living independently. Onset for ID is during developmental period. There are a few areas that can lead to diagnosis of ID, such as conceptual, social, and practical. Prevalence of ID is only over 1% worldwide. There is higher incidence in low and middle income countries. How is it possible? It may due to child infections, extreme malnutrition, and birth complications. Severe ID more often from de novo mutation, which is de novo mutation is a spontaneous appear in individuals rather than passed down from parents. ID by genetic cause, we will learn 5 different types of ID. Firstly, Down syndrome. Down syndrome prevalence is 1 in every 700 births. It caused by there is extra 21st chromosome and results in individuals with IQ at the range of 40 to 45 range. 95% of Down syndrome have entire chromosome, which is complete trisomy 21. 1% cases, some body cells have extra chromosome, which is called mosaic trisomy 21, and only a few cases that an portion of the chromosome attached to other chromosome, which is translocation trisomy 21. For the second types of ID that caused by genetics is Fragile X syndrome, is due to mutation in the Fragile X mental retardation 1 gene, FMR1. FMR1 normally contains between 6 and 45 repetitions of CGG. If the CGG reaches 200, the genes will turn off. So if the genes will turn off, no protein will be made, and individual with Fragile X syndrome IQ will typically below 75, and it only occurs oftenly to men. If females diagnosed with Fragile X syndrome, the females will have milder symptoms. Next, we will talk about Pineal Catamaria Pku. PKU is an inherited inability to metabolize amino acid phenylalanine. The excess phenylalanine interferes myelination during development. Newborn infants will oftenly be tested in urine and blood. Intellectual disability can be prevented by avoiding food that contains high in phenylalanine, such as artificial sweetener aspartame. PKU person will adult IQ will have around 20 if there is no treatment given. Next is hydrocephalus. Hydrocephalus occurs when cerebrospinal fluid builds up in cerebral ventricles. Increased fluid volumes will crowd the neural tissue, and it can be treated if the condition caught early by installing shunt. What is shunt? Shunt is a surgical insertion of a drainage system consists of a long, flexible tube with a valve that keeps the fluid from the brain flowing the right direction at the proper rate. So as you can see here, this is the normal brain, and this is the brain with hydrocephalus, in which the baby will have enlarged head and the ventricles is filled with extra fluid. Lastly, we will talk about Zika virus. Zika virus is an infectious cause of intellectual disability. It will give the devastating effects on the brain development and intelligence. Babies born to Zika-infected mother will have the condition of microcephaly. Microcephaly is a condition of smaller brain than normal. So that's all from me. Now we will continue to our next presenter, Nur Intan Fatihah. Thank you guys for listening.
Assalamualaikum and hi, my name is Nur Intan Fatihah binti Muhammad Badrin and I'm the last presenter. My part is about Autism Spectrum Disorder (ASD) and Attention Deficit Hyperactive Disorder (ADHD). The first part is what is ASD, the prevalence, impairments in ASD, and autistic savants and high functioning autism. Firstly, what is ASD? ASD is a set of neurodevelopmental disorders characterized by social deficits, communication difficulties, and repetitive behavior. The prevalence is that 1 in 150 children with 3.7% has an ASD in the year of 2000 and 2002, but it increased to 1 in 68 children in 2010, which contributes to 1.4% of the prevalence. The rates of ASD in North America, Asia, and Europe show a similarity with an average prevalence between 1% to 2%. Hence, males are 5 times higher to have ASD than females. Next, move on to the impairments in ASD. The first one is cognitive impairments. In a study of cognitive abilities in children with ASD, 55% had intellectual disability with IQ below than 70, 60% has moderate to severe disability with IQ below than 50, another 28% had an average intelligence with IQ between 85 to 115, and the last one, 3% had score IQ larger than 115. ASD children will also having communication problems like trouble to understanding verbal and non-verbal communication. They will also have difficulty with imagination. For example, pretend play. As a normal children, they will do pretend play like playing a role to be a hero or to be a pirate. But children with ASD, they cannot do this pretend play. Next, move on to social impairments in ASD. Children with ASD prefer to be alone and ignore people around them. For example, when they want to play, they will just play by themselves. And when people are calling their name, they will not answer to them. Next, interaction of ASD person with others often limited to requesting they want. For example, asking someone else to get toys where they cannot reach by pulling others' shirt or hand, pointing out to the toys and not saying any words. Hence, ASD children will treat people as an object which they will even walking or climbing over them. Also, ASD children will have limited verbalization to others and often repeat other saying, which we call as chorelia. Researchers believe that the social impairments with ASD children are because of the lack of theory of mind. Theory of mind is actually the ability to attribute mental states to oneself and others. This is where autistic person cannot infer what other people think specifically. There is a study using hand puppet and Sally to test theory of mind in ASD children. In this study, Puppet N removed a ball from a basket where Puppet Sally placed at first. Then Puppet N put it in a box while Sally out of the room. On Sally's return, the children were asked where should Puppet Sally look for the ball. Normal children will have no problem answering that Puppet Sally should find her ball on the basket. But autistic children will answer that Puppet Sally should find the ball in the box. This shows that ASD children only answer to what they saw and think and not based on the real fact of situation which Puppet Sally know. In short, that ASD person only think that whatever they say, other people should know what they've been saying about. Also, there are other impairments in ASD children, which are impairment in mirror neurons functioning, which reduce the autistic person's ability to emphasize and learn language through imitation. For example, is that autistic person can imitate others' facial expression, but their mirror neuron activity are delayed. Next is about autistic savant and high functioning autism. In autistic savant is a person with exceptional intellectual skills which are beyond normal typical genius, where savant's performance are typically faster, more automatic, and without insight into how it is done. The most famous autistic savant is Pimpin, where he actually has an average IQ score, but what he can do is he can read both sides of an open book at once, provide direction to some place by calculating the road in his mind, and also doing calendar calculating. Next, high functioning autism. High functioning autism is an individual with an island of impairment, but regardless of that, their intelligence are high. For example, is Temple Grandin. Temple Grandin actually did not develop decent language skills until the age of 6 and did not engage in decent play until she was 8. However, at the age of 9 and 12, Temple Grandin was given the Wechsler IQ test and scored 120 and 137 respectively. Next, the second part, we'll move on to what is attention deficit hyperactive disorder ADHD and its prevalence. So, firstly, what is ADHD? ADHD are characterized by impulsiveness, inability to sustain attention, learning difficulties, and hyperactivity. As behaviorally, we can see that person with ADHD will have fixating and inability to sit still, difficulty in organizing tasks, distractibility, forgetfulness, blotting out answers in class, and also having risk-taking behavior. There are three types of ADHD. The first one is inattentive type, which only show easily distracted behavior. The second type is hyperactivity impulsive type, which shows hyperactivity, constant movement, and impulsive behavior without distractibility. And the last one is combined type, which is inattentive hyperactivity impulsive type. This is where the children will show distracted behavior, hyperactivity, constant movement, and impulsive behavior. The prevalence of ADHD. This is where ADHD are the most common among childhood onset behavioral disorder, where 179 studies estimate that the prevalence are at 72% worldwide, where males are more than twice as low to be diagnosed with ADHD. ADHD actually affects every aspect of that particular person's life. For example, they are having difficulty in life, work, increased rate of antisocial personality disorder, and criminal behavior, also drug abuse. Next, the third part is about anomalies in ASD and ADHD. The first one is brain anomalies in ASD. Autism is actually was a brain disorder, but the location of damage varied among individuals. However, the striking characteristic is that the brain will undergo dramatic growth that focus on frontal and temporal areas during first year of life. And the dramatic growth will produce more folding on the brain. Hence, adult patients of ASD will increase in cortical volume and thickness with more perimeter volume in prefrontal and temporal areas. Furthermore, there are also hyperconnectivity happen in ASD brain, where we call it synesthesia, where the children will comparing something with color or number as they can feel it. For example, they will say like, Wednesday feel like blue while Thursday feel like one color. Next is about biochemical anomalies in ASD. The first one is about prenatal serotonin activity. The serotonin activity are regulated by increased level of cortisol in mother, by psychological stress, depression, type 2 diabetes, inflammatory disorders, and obesity. Hence, neuroimaging studies have found diminished serotonin synthesis in ASD children. The second one is high level of excitatory transmitter glutamate, and the third one is oxytocin as a solubility molecule, where studies found that there are reduced oxytocin in ASD person. Next, move on to brain anomalies in ADHD. There are reductions in overall volume and in 5 specific structures that involve in emotion, motivation, and reward processing, which are the caudate nucleus, glutamate, nucleus accumbens, amygdala, and hippocampus. Next, ADHD person will also have reduction in white matter integrity, which includes interhemispheric connection and anterior-posterior pathway in the brain. And the last one is ADHD person will have reduction in prefrontal and parietal temporal areas, cerebellum, and also reduction in cortical thickness. Moving on to the fourth part, which are heredity, genes in ASD and ADHD. So, heredity and genes in ASD. Sibling children with autism are 25 times more likely to be diagnosed with autism, where identical twins will have 60% risk to have ASD. Furthermore, genetic analysis estimates that half of autism cases result in de novo mutation. Usually, higher rates of ASD in males often look to the X chromosome. However, now the researchers study that higher rate in male are because of AFF2 gene mutation occurred 5 times more frequently in male with ASD rather than male without ASD. Move on to heredity and genes in ADHD. Hereditary of ADHD are averaged at 76% across studies, and consistency has been variously estimated at 58% to 83% for identical twins, and 31% to 47% for fraternal twins who have ADHD. Hence, numerous copy number durations (CMDS) that involve in synaptic transmission, neural development and learning, and also other psychological functions in chromosomal location have been identified in autism. There are also genes indicated ADHD also involved with the neurotransmitter. This is where studies already identified 24 heart genes which link to ADHD. However, the majority of the genes involved in neurotransmitters like dopamine, serotonin, and norepinephrine transmission, including synthesis, transport, and receptors. Move on to the last part of my presentation, which is environment effect to ASD and ADHD. So, the first one is the environment and autism. A study shows that children living in homes where traffic pollution was highest tripled the rate of autism. And the environmental influence can also originate from mother, which the mother having infection during the second trimester of pregnancy, which will result in bearing child diagnosed with ASD in later life. The maternal metabolic condition like obesity, diabetes, and hypertension could also cause autism in the children. And last, the mother who taking excessive folic acid also can cause children to have autism. And the last one is the environmental and ADHD. There is a genetic predisposition in parents such as maternal smoking and stress during pregnancy, parental abuse alcohol, stimulants, and cocaine, and also parental mood and anxiety disorder could cause attention deficit hyperactive disorder to the child. Furthermore, the air pollution exposed to mother will also cause the children to have ADHD. And with the usage of organophosphate pesticide like insecticide, one of the causes that children could have ADHD. As a conclusion to our presentation, intelligence is much more important in our society as it determines the placement of school, opportunities for continuous education, and employability also the promotability. However, people with intelligence disabled cannot just left behind as they might have a normal life or even successful life like us, normal person, by helping them to reach treatment for a better life. So that's all from us. Thank you for your attention and listening to us.